So we have a patient that comes in jaundiced. Why are they jaundiced? They're jaundiced because they have too much bilirubin in their blood. So the question is, how does this come about? So this lesson is about the pathologic processes that lead to hyperbilirubinemia, kind of in broad strokes, and then we'll examine each in detail. There's three major areas in the normal bilirubin metabolism that can go wrong. First, you may have a large-scale breakdown of red blood cells, which results in a large release of hemoglobin and subsequent bilirubin that overwhelms your liver's ability to conjugate and excrete them. This can be a source of what we call indirect or unconjugated hyperbilirubinemia. So how can you have a large release of hemoglobin? So the causes of this include hemolysis. There are many causes of hemolysis, and here are some big categories, including microangiopathic anemia, things like DIC, TTP, HUS. In these cases, red blood cells are sheared open by microthrombi. Other causes include immune hemolytic anemias from inappropriate antibodies produced against red blood cells, like in the setting of lupus, for example. Certain types of infection, which if severe can lead to DIC, but certain types of infection like malaria are parasites that actually live and destroy red blood cells. Hemolysis can sometimes come hand in hand with ineffective erythropoiesis. So in ineffective erythropoiesis, there's different genetic diseases or malignancies that result in the production of aberrant, more fragile red blood cells that cause one, an increase in the production of red blood cells, and two, a faster breakdown. So overall, there's a greater turnover of red blood cells. All of these things, include from hemolysis to infective erythropoiesis, they cause a large release of hemoglobin, which get broken down into unconjugated bilirubin. So the high levels of unconjugated bilirubin overwhelm the upstream processes of getting rid of the bilirubin. So this is all one cause of hyperbilirubinemia under the category of indirect hyperbilirubinemia or unconjugated hyperbilirubinemia. So we can move on to the next kind of generalized category for hyperbilirubinemia, and that would be damage of liver cells or the hereditary/acquired abnormalities in hepatocytes. So abnormalities within the hepatocytes themselves can prevent normal bilirubin metabolism. Here we'll focus on the enzyme UDPGT. We'll discuss this in detail later in this module. And kind of the last broad stroke category is obstructive jaundice, in which various diseases prevent normal passage of conjugated bilirubin through the biliary tree. If you recall, the conjugated bilirubin is soluble in blood, and it can therefore be, if it doesn't go through the biliary tree, it can be circulated in the bloodstream and ultimately removed by the kidneys. This is why patients with jaundice may have darkened urine, because the pigmented bilirubin is excreted in the urine, and then if it's not in the stool, your stool can be white. So in summary, there's three major categories that you can have hyperbilirubinemia. We'll explore these in more detail. So the first one is increased breakdown of blood products. The second one is abnormality in the liver cells. And the third is obstructive jaundice, compromise in the biliary secretion.